Hi guys, can you hear me? Hi guys, can you hear me? So this is the first time I'll be using the YouTube platform for our live Q&A session. So it's still pretty new to me. Hopefully from next week we'll have gotten a very good handle of things. All right. Guys, if you can hear me, can you just wave? Can you just wave? Yeah, no, use the comment section and just drop a wave. All right. Hi, Amaka. Hello. How you doing? All right. We have just 4 people available at the moment. Anyway, you guys, you know how we do it on Instagram? Same way we are going to have it done here on YouTube. So if you have any question pertaining to your ovulation, to your menstruation, pregnancy, or anything related to the three that I've mentioned, you can go ahead and ask. We are going to do this for 45 minutes. I'll take as many questions as possible. Hopefully, enough people join us to ask their questions. Now, the reason I had to bring this to YouTube is because I also want to grow the YouTube platform as well. You know, Instagram has been the one taking all the shine. It's high time we diversify and then grow other channels and platforms as well. That is why we're doing it here on YouTube. So if you have a question, you can use the comment section and drop your question. I'm not sure that YouTube allows people to call in the way Instagram does. All right. So if you have a question, you can use the live chat and drop your comment. Ask your question and drop it in the comment section. I'll be able to see that and I'll respond accordingly. All right. Hello, Chisom. Hi. All right. All right. Okay, let me drop something here. Okay, 5. All right. Hello, Adiola. Hi. By the way, guys, can you hear me? If you can hear me, just wave. If you can hear me loud and clear, just kindly wave so that I know that my audio is good. Okay, okay, okay. Okay, good. The audio is good. So if you have any question you want me to answer, any question related pertaining to your ovulation, menstruation, um, pregnancy, any question relating to ovulation, pregnancy, menstruation, whatever it is you have on those topics that I've mentioned, you can go ahead and ask. I'll be here for about 30-45 minutes, depending on the amount of questions that I get. So you can use the comment section, ask your question, and I'll be able to answer. All right. I'm still waiting. Oh, your question. I am still waiting. Guys, I'm waiting for your question. All right, I think we have our first question. Chisom is asking, Chisom has asked a question here. That's a question. Hi, Doc. I had asked this question to you before on your Instagram inbox. Don't know if you came across it. Is there anything as numb clitoris? If there is, what could be the cause and possible solution? Okay, so numbness of the clitoris. Yes, it's possible. You can have numbness on any part of your body. All right, so if you can have numbness on your hands, you can also have numbness on your clitoris. So it's absolutely possible. All right. Oftentimes, what may cause numbness, um, in any part of the body is maybe compression or nerve related. It could be a nerve related thing. Okay, so I'm guessing that you have a situation where maybe you are not, your clitoris is not excitable. It's as if it is dead. All right, I don't know if that explains your situation, because I've had somebody ask me something similar. All right, they complained that she complained that it's as if the clitoris is dead. It doesn't feel anything. All right, so that may be nerve related. Also, sometimes injuries that lead to damage of the clitoris, or injuries that damage the nerves of the clitoris can also make the clitoris to feel numb and unexcitable. All right, so yes, it is absolutely possible for the clitoris to experience some numbness depending on the cause. In this case, I would suspect that there is an issue with the nerves that are supplying the clitoris. Okay, so yes. Next question, please. Next question. It's Flo Talk Wednesday for those of you who are just joining. We're using the YouTube platform specifically because I intend to grow the YouTube platform as well. Enough of Instagram. It's time for us to grow the YouTube, and possible solution. Like I said, it will depend. All right, Chisom, if you can hear me, it's going to depend on the cause. Chisom, if you can hear me, it's going to depend on the cause. All right, if this is nerve related, like as I suspect it to be, then you will most likely benefit from seeing a neurologist. All right, most likely. A neurologist may be able to help because they deal with neurons and nerves and the likes. All right, but in any case, I am not entirely sure that may be due to a nerve problem. So I may have to, if you deem it fit, we can have like a one-on-one. I'll ask you some specific questions to find out the actual cause of it. Then I can advise you accordingly. If you follow me on Instagram, you can use the link on my Instagram bio to book a session, and we can have a one-on-one. All right. Any other question? I am waiting, guys, for your questions. I am waiting. All right. Lola Day is asking a question. Can you okay, she's asking a question here. I think it's an interesting question. Lola Day is asking, please, doctor, please, can you explain pseudo menstruation in newborn girls? Pseudo menstruation in newborn girls. All right. So, I mean, this is not something that is strange. All right. This is not something that is strange. So, what happens essentially is when the baby, a female fetus is inside of the mother's womb, that the baby is exposed to estrogens, lots of estrogens. All right. It is also one of the reasons why when a baby is born, you see that they have, it looks as if they have breasts. It looks as if they have breast buds. In fact, some babies may even secrete milk. Even in male newborns, they may secrete milk from their breast. We call it witch's milk. It is perfectly normal and healthy. All right. Similarly, in a female newborn baby, what may happen is a case where this baby has been exposed to estrogens throughout the pregnancy. Then the baby gets born. What happens when the baby gets born? There is a withdrawal, or let's say the supply of estrogen that they were exposed to in the mother's womb, in their mother's womb, is cut off. So you now experience what we call withdrawal bleeding. All right, so you can experience what we call withdrawal bleeding. It's not all newborn female babies that experience that, but some can experience it. Okay, so you might notice some spotting of blood from the genitalia. It is perfectly it's not something to be alarmed about. It is perfectly healthy. It's just the result of hormonal fluctuation and drop in some of the hormones, particularly estrogen. All right, yes. Next question. Um, I had top. I had top TOP. Okay, TOP. TOP. I had TOP about 3 weeks ago. When can I expect my period? Well, depending on the gestational age of the pregnancy, all right, it depends on the gestational age. Depending on the gestational age. So if, for example, it's a young pregnancy, it's an early pregnancy, right? I don't know what's happening to my screen. It seems a little bit. All right. If you can hear me, if it's an early pregnancy, yeah, if it's an early pregnancy, like let's say 4 weeks, 5 weeks, 6 weeks, your period should return anywhere between 2 to 6 weeks. 2 to 6 weeks, your period should. In fact, your period should be back. From what I've experienced with some patients who have asked me this, your period should return under 4 weeks. All right, but if it's a pregnancy that is, let's say, that was, let's say, up to 8 weeks, 10 weeks, then it might take a bit longer. But in any case, you can have a delay of about 2 to 7 weeks. Okay, 2 to 7 weeks. It's still normal. All right, during which time you are expected to have your period back. Let's go to the next question. All right, the next question. Good evening, Doc. Can one take folic acid with vitamin E for conception? A friend recommended it. She took in the month. See, folic acid does not aid conception. I have said this before. Folic acid does not promote conception. It does not boost ovulation. Folic acid is only there primarily because you are going to need it when eventually you get pregnant. That's why you need folic acid. You are going to need the folic acid when you finally get pregnant, because folic acid is important for the baby's brain development. That's why you need the folic acid. If you don't have enough folic acid stores, your baby can have defects. What we call neural tube defect. Same thing with even with the vitamin B, the vitamin E. Well, vitamin E may play a bit of a role in ovulation, but these are basically supplements. They don't increase your chances of conceiving. They do not. However, they are needed. Okay, it's fine if you take it, but taking sorry. Taking vitamin E or folic acid and expecting to get pregnant because of that, it's like being overly optimistic. It's not going to work. All right, guys, please, if you are getting some value from the session, you can just like the video so that the algorithm can push it out to more people. All right. Next question. What is the cause of egg becoming cyst after growing to a size where they should be released? Can that affect other eggs that have been released or to fertilize? Well, I mean, cysts can happen. All right. The thing you should note about this one is the fact that there is a functional cyst and there are non-functional cysts as well. A functional cyst, as you rightly noted here, the egg grows to a particular stage and fails to drop and becomes a cyst. All right, nobody essentially understands why that happens, but it happens. Okay, and it does not affect the chances of other eggs being dropped. All right, it does not. In fact, some women can have a co-occurring, they can get pregnant and still have a cyst, an ovarian cyst, co-occurring with the pregnancy, and the cyst continues to grow until maybe around the second trimester of pregnancy. Then the cyst ruptures, or the cyst ruptures. Oftentimes it causes the pregnant woman some pains and discomfort. Okay, so it's not going to stop your ability to conceive, to release other eggs. However, if it is a, let's say, a chocolate cyst, all right, a pathologic cyst that is due to maybe a disease process, then it may affect your ability of that particular ovary to release more eggs. All right, in fact, chocolate cysts oftentimes they are resolved with the help of surgery. Okay, let's get to the next question. Keep sending in your questions. Hello, doc. Good evening. Please, what is the cause of breast discharge when a woman is not pregnant, or when a woman is not breastfeeding? If she's not breastfeeding and she's not pregnant, well, it could be due to a number of things. First of all, if you are the type that you like to manipulate your breast, you press your breast all the time, you press it hard. Some women, they squeeze the nipple hard. You see that there are some droplets, clear droplets of fluids, collecting at the nipple, at the center of the nipple. This is perfectly fine, especially when you just had a warm shower. If you just had a warm bath, around maybe the time you are either menstruating or ovulating, yes, you can experience some discharge when you manipulate your nipples. Okay, but outside that, if you are not manipulating your nipples and you are noticing that you are experiencing nipple discharge that is spontaneous, that is, it's unprovoked, then it could be due very likely to the fact that you have high prolactin. Now, prolactin is the hormone that is responsible for milk production. When you have excess prolactin, or a prolactin that is commensurate with pregnancy or breastfeeding, then you start leaking milk from your nipples. That is unusual, because if you are not pregnant, you are not breastfeeding a baby. Yes, you are not pregnant, you are not breastfeeding a baby, you should not have spontaneous discharge of milk or any other fluid from your nipples. All right, now what may cause that? A very common cause of that is a very benign tumor in the brain. We call it a prolactinoma. All right, a very benign tumor. The tumor secretes prolactin. All right, it secretes very high levels of prolactin, and that can cause the woman to start producing milk even though she's not breastfeeding and she's not pregnant. Now, when that happens, there are drugs obviously that you can take that can block further production of prolactin. But sometimes some women, the tumor can get quite aggressive. When it gets aggressive, it can make such a woman, in fact, it's meant to experience it. It can make them start having hallucinations. In men, you notice that the breasts become very, very full and feminine. All right, you see very advanced breasts, very huge breasts, and they may produce milk as well. All right, in women, they just notice that they are already, of course, they already have adult type female breasts. They just start leaking milk. Okay, so depends on how the stage of the condition. If it gets to the stage whereby it is causing you headache, it is causing you hallucinations, you cannot function properly, it has affected your ovulation, you are no longer, your period is becoming irregular, you have taken some of the necessary medications that are prescribed for it, and you still are not noticing any improvement, then surgical intervention will have to be performed. So a surgical intervention will be instituted, the tumor will have to be removed, and then you have your symptoms resolved. That's how it is worked. All right, let's get to the next question. Okay, to the next question. Let's get to the next question. Will I be able to see anything if I have an early scan at 6 weeks and 4 days? Well, it depends on that. That would depend to a large extent on the sonographer, the person or sonologist who is doing the scan. Some sonologists may be able to pick that. All right, at 6 weeks they can pick it. All right, but most of the times between 6-7 weeks, you can be able to visualize the gestational sacs and some cardiac activity. All right, so if I were you, I'll probably wait complete 7 weeks proper before you go for the scan. All right, next question. Evening, doc. What causes bleeding? Someone is asking, what causes bleeding? Evening, doc. What causes bleeding, not much, while 8 weeks pregnant? though it only lasted for like 5 minutes, and a slight side cramp. Now at 8 weeks, that's unusual, so I will want to advise that you have it, you get checked. At the very least, do an obstetric ultrasound scan to visualize the pregnancy, to make sure that everything is in fact working according to plan. All right, because it's not usual for you to start spotting at 8 weeks. If it's around 4 weeks, I will understand that maybe that's implantation, due to implantation bleeding. Usually between 2 to 4 weeks of pregnancy, you can have some implantation bleeding, but 8 weeks, that's not unusual. But it doesn't mean that a miscarriage is imminent. All right, but still, for to fulfill righteousness, it's important that you get screened. So go do a scan. At the very least, do a scan, okay, and be sure. I mentioned the fact that sometimes one may have an ovarian cyst coexisting with a pregnancy. If the cyst gets to a point where it ruptures, yes, you may experience some spotting, which is not a direct result of the pregnancy. All right, but all the same, get examined, get checked. It's very, very important, because of the possibility that it may be a miscarriage, a miscarriage or something else. Okay, next question. Please, doc, can the size of endometrium during ovulation be thicker or thinner? What is responsible for this? So yes, absolutely. Yes. The thickness of the endometrium, either the endometrium is too thick or is too thin. Okay, and oftentimes it's maybe due to hormonal fluctuation. So for example, a hormone that is responsible for the thickness of the endometrium is progesterone. So women who tend to have low progesterone, that is lower than normal, they notice that the thickness of the endometrium is very, very small. The endometrium should I say, the thickness is below what is expected. It's not sufficient. Now, what is the implication of that? For such women, they may not even to a large extent experience substantial or adequate bleeding or blood volume during menses. Another thing again is they may experience, they are likely to experience a miscarriage when they get pregnant, because the progesterone is too low to support an endometrial thickness that can sustain the gestation. It's very important. This is why women who oftentimes have low progesterone, when they get pregnant, we place them on synthetic progesterone, Dufaston. We place them on that to compensate for the decrease they had prior to pregnancy. Okay, now again, it can get too thick. The endometrium can be too thick. Oftentimes, some women, particularly in women who probably are in their 50s, if the endometrium is too thick, we may want to investigate and make sure that it is not due to endometrial cancer. So the endometrium can get too thick and it can get too thin. All right, next question. All right, what could be the reason for a knot-like pain in the left abdomen part, pain lasting for about, okay, what could be the reason for a knot-like pain in the left abdominal part with the pain lasting for about 10 hours? Well, if it's happening around your fertile window, I would say that is a case of ovulation pain, aka Mittelschmerz. Right? Ovulation pain can cause that kind of one-sided lower abdominal pain. Okay, it's due to the rupturing of the egg. That's one theory that explains it, that tries to explain ovulation pain. All right, so if it is happening around your ovulation, certainly it's ovulation pain and it is normal. You don't need to lose any sleep over this. But if it's not happening, or if it's happening outside of your fertile window, you should get a scan done and be sure and make sure that it's not due to something like ovarian cyst or something else. All right, but if it's around your ovulation, you can you can be rest assured that it is more likely a case of ovulation pain, which you can manage with painkillers. Paracetamol does not work. Paracetamol does not alleviate it. You can take other stronger painkillers like diclofenac or Felvin if you don't have ulcer and you are also not asthmatic. Next question, doc, please can the breast discharge prevent a woman from conceiving? Yes, it can if it gets to the point where it starts to affect your ovulation. Yes, so that prolactin I talked about earlier, it gets to a point, it keeps rising to a point whereby it starts to block ovulation. If it starts blocking ovulation, what you notice first of all is that your period will become irregular. So your period that used to be very regular before, all of a sudden you just notice that it is no longer regular. It is skipping by a couple of days. All right, so yes, it can get to a stage where it affects the woman's ability to conceive. Okay, yes. Next question. Guys, go ahead and like the video. Please go ahead, if you are getting value from this, like the video so that the algorithm can push it out to more people to see. All right. Meanwhile, please, the crowd is not much here, so you have the opportunity to ask as many questions as possible. Use the opportunity. By the time we grow and get large enough, you may not have that opportunity to ask several questions at once. So now you have that opportunity. Please ask as many questions as you want. I am here for another about 15 minutes. I'll answer everything. Okay. Next question, please, doctor. Does oxytocin get to be released during foreplay, or causes of cramps during foreplay, or causes okay, I think I understand your question. You are talking about oxytocin. Yes, oxytocin gets released during foreplay. Oxytocin gets released during foreplay. Oxytocin gets released during sex, especially when the sex is orgasmic. All right, it is also one of the reasons why when you orgasm you may experience some level of contraction. Okay, you experience some contraction, uterine contraction when you orgasm. So yes, oxytocin plays a role in that event. All right. What was the other question? Yes, it causes some cramps. You know, it can cause some cramping of the uterus, particularly when you orgasm. All right. Now, oxytocin is also known as the love hormone. Okay, so it's one of the hormones that makes you, you fall in love after a man. Now, let me even shock you. Breast fondling of the breast, sucking of the breast, all of this, they fall under foreplay, right? Yes, absolutely. They cause oxytocin to be secreted, and the more oxytocin that gets secreted, before you know it, you just bond to the person. You just notice that you are in love with the person. That's why it is known as the love hormone. Okay, that's why oxytocin is called the love hormone. Yes. Next question. Please go ahead and ask your question, guys. Ask your question. Okay, just a minute. Okay, next question. Still on the size of endometrium. If the size of the endometrium is equal to 6 millimeter, is this something to worry about? I can't remember the exact size that is adequate. Okay, I'm not so sure. So I won't be able to give you a very, very definite answer to that. Okay, I will have to check. Someone is asking, I had a chemical miscarriage at the 5th of last month. My period is late for 1 day now. Is it possible for me to be pregnant? Absolutely. Yes, it is very possible for you to be pregnant again. If you had sex, yes, it is very possible for you to be pregnant again. Absolutely. Okay. I'm sorry about the chemical miscarriage. Sorry about that. Please, doctor, is cold water or any cold drinks very safe in pregnancy? Yes, absolutely. I mean, imagine the amount of heat that you tend to feel during pregnancy. The heat is much. Oh yeah? Somebody now tells you that you should not drink cold water. What's wrong with the person? You drink your cold water. It is not going to affect your pregnancy anything. Of course, I've heard some very ridiculous claims like if you drink cold water, the baby is going to have pneumonia, or if you drink cold water, the baby is going to catch. What kind of ridiculousness is that? It is absolutely false. Okay, go ahead and drink your cold water if that's what you feel like drinking to cool down your temperature and your temper. All right. Yes. You can take cold water. You can take your right, but you may want to avoid Zobo. Okay, you may want to avoid Zobo. You can take your malt. That's fine. Avoid Zobo. Avoid alcohol. Okay. Yes. Absolutely. Next question. Next question. Next question. Please, doc, does breast discharge prevent a woman? I have answered that already. I just answered that. Okay. Doctor, please, what is the cause of recurring infection? What type of infection? And what can cause infection for a woman without multiple sex partners? What kind of infection are you talking about? Are you talking about yeast infection, bacterial vaginosis, herpes, chlamydia, gonorrhea? What type of infection? It depends. If you are talking about yeast infection, which is like one of the commonest infections that vaginal infections that women battle with, then there are many things. By the way, yeast infection is not an STI. All right, yeast infection is not an STI, which is why women who are not sexually active can also have it. All right, women who are not sexually active can also have yeast infection. Okay, women who are not sexually active can also have yeast infection. So it is not a sexually transmitted infection. Now, what are the causes, or what are the likely factors that can make you develop yeast infection? Number one, if you are washing the inside of your vagina, the vagina, you have the vagina which is inside, and you have the vulva. Oftentimes when women say vagina, they are referring to the vulva. Vagina is where your menses comes out from, right? That is also, for those of you who are sexually active, where the penis enters during intercourse, assuming you are doing vaginal sex, because people do anal sex, some other people do oral sex. I'm talking about vaginal sex. If you are doing vaginal sex, where the penis enters, that's where the vagina is. All right, so you are allowed to wash the outside. That's where that's the vulva we are talking about. What you see on the outside, your camel toe. Okay, that is your vulva. You can use mild soap to wash the outside because it gets sweaty, it gets oily. You can use some soap to wash that. It's perfectly fine. All right. However, do not attempt to wash the inside where the penis enters or where blood comes out from. Do not do that. When you try to do that, you are going to you may eventually disturb the pH balance of your vagina, and that can predispose you to having vaginal infections or vaginal yeast infections. All right, so washing of the vagina, it's a no-no. The vagina is self-cleansing. You don't need to wash it for you to feel clean. Another thing is abuse of antibiotics. Of course, in the vagina there is a bacteria called lactobacillus. It's a good bacteria. Lactobacillus acidophilus is a good bacteria found in the vagina. It makes the vagina acidic. When the vagina is acidic, okay, it is unfriendly. It poses an unfriendly threat to disease or pathogens like yeast. Okay, so when you abuse antibiotics, those antibiotics are also going to destroy, or they are going to kill those beneficial bacteria that you have in your vagina, and that can release their population and make you vulnerable to having vaginal yeast infection by virtue of the fact that the pH balance gets disrupted. Of course, another issue or another likely risk factor is pregnancy. So women who are pregnant, they often suffer from severe recurrent yeast infections because of the hormonal fluctuations. It causes some level of pH it disrupts the pH balance of the vagina and makes them prone to having those infections. Another explanation is the fact that in pregnancy, the immune system is suppressed. So some of these opportunistic infections can have a field day and mess up the whole place. All right. Yes, multiple sexual partners can also play an important role here. Like I said, yeast infection is not an STI, right? Yeast infection is not an STI, but still, if you are having multiple sexual partners, what that can do for you is that sometimes that's, multiple sexual relationship that you are entertaining or you are maintaining can lead to disruption of your pH balance. This is something that is quite interesting. You see, every man has a unique flora. Flora are, microbes that are found on our bodies, all right, living microbes that are found on our bodies. Every man has a unique flora on their penis. Okay, just the way some women have unique flora of their vagina. So when you get exposed, or when you are with a partner, after a long period of time, right? After a long period of time, your vagina eventually gets used to the flora found on the penis of your partner. So it finds a way to coexist with it. What you do when you have multiple, or you maintain multiple sexual partners, is you have one particular partner that you have been, having sexual relationship with. Your vagina has somehow gotten used to the flora on their penis. Then you introduce it to another flora. You introduce it to another flora from another man. What happens? The vagina gets confused. That can lead to some disruption of pH balance and make you prone to having infections like vaginal yeast infection, particularly bacterial vaginosis. So yes, maintaining sexual relationship, multiple sexual relationships can increase your risk of having yeast infection and other infections, including STIs. Okay. Then again, if you have diabetes, it can increase your risk as well. Some other conditions, if you have HIV, disease conditions that suppress your immune system. Yes, in fact, when you're now talking about yeast infection, it gets to a point where if somebody is having recurrent yeast infection, maybe in like 1 year, you have treated yeast infection for up to 4 or 5 times. If you come to me, I'll most likely ask that you do an HIV test just to be sure that there is nothing that is trying to suppress your immune system and make you vulnerable to recurrent yeast infection. So yes, that's that. Next question. Next question. We have just a few more minutes and we'll be done. Doc, please, what can one use for Doc, please, what can cause constant miscarriages in a woman? There are several things. I can't exhaust them here. It could be infection, right? Infections can cause recurrent miscarriages. Another condition that can explain recurrent miscarriage is resource incompatibility. I posted a video about abortion. Why you should know your resource factor before you go for an abortion. You can look the video up. That was my latest video on my YouTube channel. Look it up, please. Okay, look it up. Now I explained the fact that if you are resource negative, if you are a resource negative woman and you get sensitized, if you are resource negative, you are pregnant with a resource positive baby, that can happen when you make a baby with a resource positive man. So the baby inherits the resource factor of the mother or of the father. So if you are resource negative and the man you are making a baby with is resource positive, it means that your baby has a 50-50 chance of inheriting the resource factor of the father. If that happens, it means that the pregnancy is going to be resource positive. Now, during delivery, during a miscarriage, or any invasive pelvic procedure that causes bleeding in that pregnancy, or you undergo an abortion, okay, what can happen is the baby's resource positive blood can mix with the mother's resource negative blood and cause sensitization to happen. If sensitization happens, of course, that first pregnancy is going to be safe, but subsequent pregnancies where the baby is resource positive, the antibodies that you have produced are going to attack that pregnancy, attack the baby's resource positive blood, and eventually cause a miscarriage. So that is another explanation for recurrent miscarriages. Another one is something we call cervical incompetence, where the cervix is not competent. Either it is too short or it begins to dilate and expand prematurely, even when the woman has not attained has not reached the stage where labor should happen naturally. When that happens, such a woman can witness, in fact, it is so specific that you notice second trimestral miscarriages. between 12 to like 18 weeks, that's when you notice that the pregnancy miscarries. And it can be so spectacular that oftentimes the baby just falls off. All right, you can see the baby pushes out, the baby, like unlike the other ones where you miscarry, you notice some bleeding, then you go and do MVA, manual vacuum aspiration, to clear the remaining remnants of this thing, products of conception. Yes, you go and do all of that. I am talking about this one. You can have everything just fall off from your cervix. Okay, second trimester miscarriages as well. Then other drugs, maybe you are exposed to other drugs, medications, they can also lead to recurring miscarriages, particularly if you are not aware. So these are some of the explanations. There are quite a number of them, but these are some of the explanations that one may want to consider. Okay, doctor, please. What is the cause of not seeing our period close to 2 months now without you being pregnant? Well, stress. All right, you can be stressed. Stress can actually affect your cycle and lead to cessation of flow. So stress, very important. Either mental or physical stress, it can affect you. Relocation, when you relocate to let's say a different time zone. You were in Nigeria previously, then you relocated to, let's say, Canada, or let's say China. All right, that's a different time zone from ours. What is going to happen there is that you can experience some fluctuation in your cycle, which can lead to either delayed menses or your menses coming earlier than you had expected. That can happen. Another one is changes in weight. Either you lose a lot of weight very quickly, okay, or you gain a lot of weight very quickly. That can also cause some of the that can also cause cessation of flow or of menses for that long. Another one, drugs. If you are taking hormonal contraceptives, your postinol, you are using any other hormonal contraceptives, it can explain that as well. If you are just starting your menses, it can explain it as well. So the girls who are probably 15, who are 13, 14, 15, they are just starting their menses. Sometimes it can take for like 3 years before they eventually get to a stage where their periods become very regular. Okay, so it's not unusual for girls who are just starting their menses. If you are nearing menopause, of course, that can also explain it. Another cause could be that you have hormonal imbalance, which could be due to polycystic ovarian syndrome. It could be due to hyperprolactinemia. I discussed it earlier, the one that makes you start leaking breast milk. If it gets to a particular stage, it can actually disrupt your cycle and cause period irregularities. So these are quite a number of, in fact, even chronic illnesses as well can cause period can make your period skip. All right, can make your period skip. I don't know if that answers your question. However, there is a way you can actually induce your period. Okay, if you get into a stage where you are becoming concerned, you want your period to come, you can induce your period. But I'm not going to say that here because I have a special video for that. How to induce your period. That's the first video. No, that will probably be the second one. The first one will be how to postpone your period. It will be dropping on Saturday on my YouTube channel. All right, so I'll explain that, then I'll talk about how to induce your period. All right, next question. It's a little bit hot here. They have taken light. Okay, next question. I think I've explained it. Okay, I've explained that. Is there any way one can track how many eggs release or whether fertilization or implantation happens? Is there any way one can track how many eggs release or whether? Well, yes. If you do folliculometry, they can tell you the number. For example, if you have, if you go for folliculometry, it can tell you whether you have 2 mature eggs or 1 mature egg. Most women only have 1 mature egg. All right. You could have just 1 in 1 ovary, or it could be a case where you have 1 in 1 ovary, another 1 in the other ovary. So you can release both eggs, and you stand a chance of getting, getting pregnant with twins. When you release 2 eggs or more than 2 eggs, you stand a chance of getting pregnant with twins. We call it a non-identical twins. You can get pregnant with non-identical twins. All right. That's it. Don't forget that For identical twins, it's just one egg and one sperm cell. They fuse together, then they divide into 2 or 3 as the case may be. Okay, so yes, so you can monitor your ovulation, you can monitor the egg. In fact, you see how the egg is growing, you can monitor it with the help of folliculometry. So go tell them that you want to do folliculometry or ovulation scan. All right, you can monitor it. In fact, for some cases, they might even be able to predict the day that the egg is going to drop. They might be able to predict that when the egg is going to drop. All right, next question. Next question. Next question. I think I've answered that. Doc, please. Is it that a woman who is trying to conceive shouldn't eat pineapple? Well, you can eat pineapple. You can eat pineapple if you are trying to conceive. But when you get pregnant, all right, when you conceive, especially during your early pregnancy, you may want to avoid pineapples, because some women have claimed that, all right, when they eat pineapple during their early pregnancies and they miscarry. Well, that's primarily all. But generally, the research available is that the contractions, the uterine contractions that pineapple causes, is not sufficient to trigger a miscarriage. It's not sufficient to trigger a miscarriage. Okay, so that is very important. That is very important. Be that as it may, just to be on the safe side, avoid pineapples during your your first trimester. You might want to avoid pineapples. When you get to your third trimester, you can even eat pineapples, because they can actually enhance labor. They enhance labor and they make labor a lot easier. So by the time you have gotten to term, you have gotten to 37 weeks, you can start eating pineapples, particularly the stalk of the pineapple, the inner stalk, the innermost stalk. It contains excess amount of bromelain. Bromelain is the substance or the agent that is responsible for uterine contractions. Okay, all right, so that about that. Okay, I think our time is up. One more question and that will be it for today. Doc, please, are there drugs one can take to conceive twins? Well, we don't advise that you try to conceive twins. We do not do that. We do not. If you are conceiving twins, you conceive twins, you conceive naturally, that's fine. But we don't try to say you should conceive twins when you are perfectly fine. You are releasing eggs, your partner is fine. It's not some, because having multiple pregnancy is a high risk pregnancy. Any multiple pregnancy is a high risk pregnancy. They have their, multiple pregnancies have their own challenges. All right, so we don't recommend it. Having said that, some women, when some women are having issues with ovulating, we prescribe drugs that help them to ovulate. One of those drugs is Clomid. Now, one thing that Clomid does is that Clomid can stimulate the ovaries to release more than one egg. Now, if your ovary is releasing more than one egg, you stand the chance of getting pregnant with twins. All right, so some women, because of this, they take Clomid. All right, but don't forget the fact that Clomid also has its own issues. If you are taking Clomid, your risk of having an ectopic pregnancy also increases a bit. It's very important. So don't use Clomid primarily because you want to have twins. There are indications for Clomid. If you are not indicated for its use, do not take it, please, because of some of the potential issues associated with Clomid. All right, okay. We can give, for women who are going for IVF, sometimes we give Clomid. Those who are, Clomid is one. Another drug is letrozole. Sometimes we can even give HCG injections, to cause multiple eggs or a lot of eggs to be released so that they can be harvested and used for IVF. All right. I think that will be my last question for today. Thank you so much, guys, for joining. We are going to do this next week. Okay, we are going to do this again next week. For those of you who had questions, I think I answered all the questions today because of the fact that we were not very plenty. Okay, hopefully maybe next week we are going to have a larger audience, and we're able to take more questions. All right, thank you guys for joining. Please If you have not subscribed to my YouTube channel, please help me to grow. I'm begging you guys, help me to grow. I want to grow my YouTube platform as well. Subscribe and turn on the notification bell so that you get notified whenever it is I post. Having said that, you'll have yourself a very beautiful evening ahead. Bye-bye.